Good morning, friends. I'm really thankful to Dr. Padaria for asking me to deliberate on the varicose veins, the risk factors, the signs and the symptoms, and the grading of the severity in a symposium on the varicose veins in this vein week. As all of you know that varicose veins are the twisted, enlarged, dilated veins, and they usually are found in the lower limbs, but they can occur in other parts of the body also. If you look at the evolution of man, when we were the quadrupeds were there, then we never had the varicose vein, but as we started standing on our two legs, we started developing the varicose veins. And as we gained our weight, even more chance of having the varicose veins are there. And probably if we again become the quadruped, probably that may take care of the varicose veins. And you look at the digital India in 1995, we were thin and our TVs, they were fat, but it's just the opposite now. And because of the prolonged standing and sitting over a computer is one of the risk factors for the varicose veins. If we look at the incidence of overall the venous disease, in 30 to 50%, we do not have the venous disease, but in about 25 to 30% cases, there is varicose vein is there, and it becomes the severe varicose vein in about 5 to 16%. It's like the CVI in the almost the same population. And then sometimes you can have the ulcer, the varicose veins, in about 8% of the case. There are several risk factors. One I told you is the prolonged standing is there. Then the female are more likely to have the varicose veins. Immobility, especially patients may be developing the DVT in these patients, the deep vein thrombosis, and that may be the cause for the varicose veins. Any cause which increases the abdominal pressure, like the patient is pregnant or there's a pelvic tumor is there, may lead to the varicose veins. Increased progesterone in the females can lead to the varicose veins. The girls and the ladies walking with the high heels is one of the risk factors for the varicose veins. Obesity definitely is a risk factor for the varicose veins. It may run in the family, and as I told, in the pregnant females, there is likely to have the varicose veins in the legs. So there are several risk factors. It can be the hormonal risk factors, especially in the female gender, because of high estrogen state. It can be because of lifestyle modification, prolonged standing or sitting, or patient who was smoking will lead to the venous hypertension, venous endothelial injury. It may be acquired variety, that patient having the obesity, a pregnant patient having the DVT, and advancing age, all are responsible for the varicose veins. And then there can be inherited category may be there, like it may run in the families. Patients who is tall in height are supposed to have more likely to have the varicose veins. And there are several congenital syndromes. There also you can get the varicose veins. So if we know the risk factors, can you prevent the varicose veins? Answer is probably no. But probably you can help some way, that you can avoid prolonged period of sitting or standing. If you have to stand for a long time, it is better to walk for some time. By using the compression hosiery, it can be of some help. Having a good lifestyle, having a good nutritious food, preventing the overweight, carrying out the exercise, and a pregnant lady sleeping mostly on the left side may probably prevent the varicose veins. So these are the few factors, but otherwise we can say that probably we cannot completely say that you can prevent that, but these are the few factors which are there. So how does your patient present? what does he feel? He will feel an ache or heavy feeling in the legs. There may be burning, throbbing, muscle cramping, and swelling in the legs. The pain will be worsened after prolonged standing or sitting for a long time. The patient may have the nocturnal cramps and there may be itching may be there. Now, what you can see, the veins that are dark purple or blue in color, you can very well see these veins. Veins that appear twisted and bulging, often like the cords. You can see these veins like the cords on your leg. There is a skin discoloration may be there around the varicose veins. There may be small spider veins may be there. The patient may have the edema around the ankle, and sometimes there may be the complications of the varicose veins, like there may be bleeding may be there, or there is a dyspigmentation of the skin is there, or the patient may have the venous ulcer. So there can be the hemorrhage from the varicose vein. There can be pigmentation. Periosteitis may be there, and that can change the gait of the patient. In the venous ulcers, sometimes there can be change into malignancy, what's called a marginal ulcer. The patient with the lipodermatosclerosis, then with the Talipes equinovarus may be there. The patient with the deep vein thrombosis, and the patient may have the recurrent Thrombophlebitis. So all these are the complications by which the patient can present to you. So varicose veins are of three types. One is called as the spider veins, where they are very small. Like these veins, you will label it as a spider vein here, which is less than a millimeter in size. This you will label as a reticular vein, which is 1 to 3 millimeter in size. And this you will label as the varicose vein, which is usually more than 3 millimeters in size. So you can see this varicose vein here. You can see these small veins and the reticular veins there. There will be big veins which may be there. And like see this type of the vein is very likely to rupture at this point because these are the weak points and there can be rupture and the patient can come to you with a severe bleeding. The patient may have the lipodermatosclerosis. See the upper part of the leg is so much swollen while the lower part is narrowed down here. So this is also called as the inverted champion sign. And there can be various grades of the pigmentation may be there, which can be just in the spotty, or it can be involving almost whole of the leg, or it's the blackish coloration of the whole of the leg. There are various grades of pigmentation can be there in the patient with varicose veins. So this is the ankle flare. There are small veins which are there. It was initially thought it's a relatively benign condition, but now it has been found that this is a case of advanced varicose vein. So it has to be taken very seriously, this ankle flare. And then there can be Sephna varix, like this swelling which is there in the inguinofemoral region. You find this type of the swelling, and this gives the cough impulse like any hernia which is there and can be mistaken for the hernia. And as I told you about this lipodermatosclerosis, that's the champion. So thick part here in the upper part, while this is a narrowed one here. This is called an inverted champion bottle sign, a feature of the lipodermatosclerosis. And then there can be Talipes equinovarus, maybe there, this is a deformity, and you find the patient has got the periosteitis. And then there can be the ulceration over the leg. So this is little one of the commonest site that on the medial side of the ankle, you find ulceration. And this is because of the huge venous hypertension here, and because there is a great saphenous vein which is on the medial side here. So this is the commonest site. This is also called as the gaiters area. And then you can see this ulcer is there on the medial side of the ankle here, but now it has developed a malignancy over that. That's the marginal ulcer which is there, a squamous cell carcinoma developing over a prolonged venous ulcer. And then there can be thrombophlebitis. This may be a de novo type of thrombophlebitis, or it can be because of like you give this patient the sclerosants as a treatment, then you can find the patient having the thrombophlebitis. So all these are the presentation of the varicose veins. So you can also have the eczema, you can have the ankle pigmentation, you can have the lipodermatosclerosis. Then sometimes it is not only the lower limbs, it can occur what is called the pelvic congestion syndrome, that there is problem in the veins in the abdominal cavity there, and you can find that there may be the vulvar varicosities may be there, or the varicosity in huge varicosities in the upper limb or in the lower abdomen or the groin. So it can present in the various ways. There may chronic pelvic pain may be there, the various other pains in the back, limb, thigh. Irritable bowel syndrome is one of the features. In the pelvic varicosities, there can be the gluteal varicosities, varicocele, and hemorrhoids may be also a presentation because of that. And then it can occur in the upper limbs also. You can see that there are varicosity vein, and this is maybe the various reasons that there may be valvular incompetence, like in the lower limb, there may be a thoracic outlet syndrome, or the axillary vein thrombosis may be there, or the patient having the arterial vein fistula can present with the veins like that. And then there can be various syndromes, and one of the commonest syndrome which is we see is the Klippel-Trenaunay syndrome, and where you can have the other type of the syndromes may also be associated with the varicose veins. Now, what is this Klippel-Trenaunay syndrome? This is basically you find that there are varicose veins are there, then there are multiple spots, and there's a hypertrophy of the limb which is there. So the limb will be larger, it will be longer and warmer than the normal. Now, you can carry out the various clinical signs. So there are several signs, and you have to test for the superficial venous system, you have to test for the deep venous system, and you have to see for the perforator incompetence. And various tests can be done for that. And these are the various things, like you can do the Trendelenburg test, which can be done for the saphenofemoral incompetence. You can do the multiple tourniquet test. You see for the various perforator incompetence. You can do the Schwartz test. You can find, especially if there's a cross varicosity of the vein, then thrill may be there. Or you can do a Perthes test, where you see for whether the patient has got the deep vein competence or not, because this is one of the most important tests which is there. Because if once the deep veins are blocked, then in those cases you cannot ablate the superficial veins. So this is very important to know, does the deep veins are patent or not. And then you should also do the ankle brachial pressure index in these patients, because if the ABPI is less than 0.9 or 0.8, then in those cases you have to be careful, because one of the reasons, one of the treatments for the varicose vein is the compression treatment. So if it is a ABPI less than 0.8 is there, then you have to definitely reduce the pressure of the compression stocking which is there, or even you may not use the compression stocking for the treatment of the varicose vein. And then to look for the severity of the vein, there's a CEAP classification which is there. This is the stands for the clinical, the etiological, the anatomic, and the pathophysiological. And you look into the various C categories which are there. And this you can see that the C0, that it is a normal one. C1, there are small like the spider, and the reticular veins are there. C2, you find there are varicose veins are there. C3, there is edema is there. Then C4, A and B, where the pigmentation is there, or there is a lipodermatosclerosis there. And also nowadays it has been added as the ankle flare is there in the C4. Then C5, there's a healed ulcer is there, and C6 is the active ulcer. So this is one of the classification which is done for the severity of the varicose veins. So the E part is whether the etiology of that, whether it is a congenital or primary or secondary, and you are not able to find any cause for that. It is anatomical, depending upon which system is involved, which vein is involved, and it can be a pathophysiological, like is it a reflux or is it the obstruction, the cause for the varicose veins. Now, this study in 2008 carried out at the age of 60 years, looked all the persons at the age of 60, and they found that 29% is a C0, means there is no varicose veins, but almost about 71% of the patients, they had some features of the varicose veins, starting from these spider veins or the varicose veins, and further the CVI, which is there at the age of 60 years. And then there is another severity score is there, which is called a venous clinical severity score, which looks into the 10 parameters which are there, and each parameter has got the 3 parts. So the total score is 0 to 30. So higher the score is there, bad is the outcome for these patients. So this is another way to look into the severity of the varicose veins. Thank you very much.